We are here today with Ashok Kothamasu. Ashok, you are one of the members of Teen Voices for Change, and you work on educating teachers, parents, and school boards on the hazards of electronic cigarettes and other harmful substances. And you've been instrumental in starting their prevention advocacy program. So thank you so much for your leadership.
Of course.
So, what inspired you to become a youth leader in the fight against addiction and the drug epidemic?
Yeah, so it's a little bit complex, but on the surface level, I witnessed a lot of smoking in India, where I'm from, and I saw that same mirror effect in my youth community here through vaping, and I realized that the impact was exacerbated completely during the pandemic. To go a little bit deeper, I did speech and debate, and we often debated solutions to problems, but those solutions didn't come into fruition. And discussion is important, but I soon realized that I should foray into advocacy and drug prevention so I can actually implement those solutions instead of just talking about them, if that makes sense.
Yeah. And can you tell us more about Teen Voices for Change and what you do?
Yeah, so Team Voices for Change is a drug prevention platform, and you could say it's a healthcare advocacy team group. And basically, what we do is that we implement programming in schools from teaching teachers about new drugs that are coming into the school community or talking about just mental health wellness through library initiatives. I think last year we partnered with a library and we held a mental health makerspace where we talked about mindfulness and we brought in a therapy dog. It was really cool. In the advocacy sense, Teen Voice for Change has connected me to a lot of opportunities to talk to state legislators. And speaking of legislators, it's connected me to organizations like CADCA, where I've been able to talk to legislative aides with federal government policies to Congress. It's really cool. Yeah.
Great cause. And can you share with us some personal stories where you felt like you had an impact on the students in your community regarding drug prevention or recovery?
Yeah, so I think when talking about student impact, I would say the main initiative I took on, or capstone project in this case, was when I submitted a grant to the school district about teaching middle school students drug prevention skills and drug refusal skills, so then they can go on and teach elementary school students those drug refusal skills. So it was like a peer-to-peer program. And the reason why I did that grant was because there are peer teachers where high schoolers teach middle school students, but there aren't peer teachers where students go and teach elementary school students. So I think that's the biggest impact I had. And to really crystallize that, I remember talking to a student I was training in this program, and she came up to me and said that so and so, one like person they looked up to, said that I'm using vape pens and using drugs in high school is normal. And she told her that that's not normal. I'm fighting for drug prevention. And that goes to show the impact I'm making with that.
And what steps do you think students, middle or high school, can take to avoid falling prey to drugs?
Yeah, so I wish there was a manual for that, right? A step-by-step instruction point. But in all honesty, I think it's important to be more mindful of your decisions, not just with drugs, but any type of decision you make in terms of your life, such as right now I'm going to college, such as picking a major. And that's the same thing that goes with drug refusal skills. Be mindful of what situation you're in. Sometimes it is a peer that you've known for so long asking you to try this substance. So stick to your gut. And sometimes your gut is wrong. And that's why we have education in place. But try to, first off, have a mentor that is healthy and is not just saying they're healthy, but taking actions in that consideration. So I would say establish that mentor and learn from them because there is no step-by-step instruction manual, but I wish there was. But we're humans after all. So yeah.
And what are some top strategies when you talk to someone uh, like your peers who you might suspect having an issue with drugs?
So I think the number one thing is listening because when we talk about prevention and harm reduction, we deal with a lot of intervention and trying to do stuff such as talking to this person. But listening sometimes gets folded under many layers. So listening to someone and why exactly they're using this substance is important because I think it's common medical knowledge and medical model that addiction and substance abuse is part of a convoluted problem that deals with mental health illness or a substance use disorder, and it's a disease. So understanding the root of the issue is important. And in order to do that, the top strategy is just listening to a person and understanding their perspective and realizing why exactly they're using that substance and how exactly can we stop this dependency. And second, also realizing how your responsibilities tend to fall in. You're not a medical professional oftentimes when you're talking to this individual. So realize your boundaries and set those boundaries as well.
Great advice. And there's a lot of talk on social media's role in accessing harmful substances. So, what is your advice for social media users?
So yeah, social media is big, right? It's has a huge impact, and we really need to do more research on the impact of drug abuse in social media and how they intersect. I think there was a panel in Congress the other day, not the other day, a couple of years ago, on how TikTok and social media affect the mental health of teens, and we really didn't get the answers we needed with that testimony because one, we were not so mindful about how important social media is. And social media helps individuals connect with each other, but it also makes those wrong connections easier to make. So, yes, social media has a big role on drug addiction and drug abuse. And again, just being more mindful of what you're following and what you're posting. And sometimes we get another convoluted outcome. When you look up to an individual, such as a celebrity through social media, that's endorsing this product, it's really hard to look away. But realizing what exactly they're endorsing and doing your research is important because graphic design sometimes lures people in. And when you talk about the vaping epidemic, you see that there is a lot of graphic design that is centered towards you, the colors that pop and designs that look clean and seamless. So again, being mindful is really important. And it's hard to be mindful, but take steps into that consideration.
And how can more students be a part of Teen Voices for Change? Is there a selection or training involved?
Yeah, so Teen Voices for Change is purely you go to a meeting and you get involved. I think what I always talk about in any meeting or any group setting, that Teen Voice for Change is something you make it out to be. It's not this club that's clear cut like NHS where you have to do volunteer hours or you have to sign this oath or book. Teen Voice for Change is more of a platform for you to take it and do something with it. For me, it was a lot of advocacy-based initiatives and healthcare initiatives. For some other people, it's just about having a good space to talk about their problems. Ms. Knos does an amazing job about listening to you as well. And I think Teen Voice for Change has in the past done youth mixers. So it's really something you can do anything with. And yeah, I think it's really cool because a lot of clubs have clear-cut standards and certain things you have to do, but Team Voice for Change gives you the funding, the people, and the connections to do anything you really want with your high school career that's in the sphere of advocacy and healthcare.
And um, are we doing anything to differently to fight the ongoing fentanyl crisis currently?
Yeah, so there was actually a big chunk of CADCA. I don't know if you're familiar with that, but their conference, they're a conglomerate of drug coalitions, and they were talking about how this crisis is really big. And in terms of what we're doing differently, I could say that I don't know yet. I really don't know if we're doing anything differently. We knew pentanol was a big thing when I was in middle school, and we should have done something then. A lot of prevention should be proactive, not reactive. And we should have been more proactive with this problem. But what I do know what we're doing differently now is that we're educating. And just saying something is bad isn't going to change someone's viewpoint, right? Educating them on why it is bad is going to change their viewpoint. A big thing with fentanyl is that some pills are laced with another substance that's very deadly. And there's the cookie cutter effect, where certain parts of the pill or certain pills are not as deadly as other pills. And there's a lot of information and PSAs going on about that specific effect. And that's really important. That's the proactive piece. So I think what we're doing differently now is we're being more proactive than we did with other epidemics like vaping and cigarettes.
That makes sense. And do you think we can end the crisis soon?
Yeah, I wish I could say that. The heroin epidemic was a big epidemic, right? It did end. I don't like using the word end because I think it creates this myth that we don't have to do anything about it anymore. But reducing the effect, I think it can happen. Again, being proactive and not reactive is really important in prevention. And also another thing that we should do with fentanyl to end the epidemic is not look at harm reduction, but look at prevention. I think a lot of things that happen with fentanyl right now are dealing with harm reduction, not prevention. And sometimes we're so passionate about stopping a problem. And there's a blurry space, you could say, between harm reduction and prevention. Harm reduction deals with just lowering the deaths of fentanyl, but prevention deals with actually looking at each case and seeing why exactly they're going back to that substance. So if we keep on using the prevention framework while also working at harm reduction, I think we can not end, but lower the effect of the epidemic.
Yeah. And what are your future plans in terms of college career and your work in drug prevention?
Yeah, so in terms of college and career, I'm going to UMKC's medical program. And in terms of prevention, I hope to still have a good stake in this problem and understanding that there's solutions to be made. I am part of the National Youth Action Council with CADCA, but my term is ending soon. So I think I'm going to be centralizing a lot of my work on local communities in Kansas City if I can. That being said, I don't know where that's going to lead me, but I really want to work in research. Again, I don't know where that's going to lead me, but I do want to have a bigger stake in prevention work, if that's a good answer to say.
That was great. Thank you so much for this interview as well.
Yeah.